Good afternoon, good morning, good evening, however this finds you. My name is Madeline Brooks, and today I will be talking about my proposed research study. So, within the literature that I looked at, one area that really needs to be researched further is the reasons for addiction, such as genetics, individual traumatic events, and environmental circumstances. The one that I'll be focusing on is environmental circumstances, and I believe that that could use some more research. So the research question for this topic would be, when considering substance use disorders, how do suboptimal environmental circumstances factor into the forthcoming of substance abuse within adults? And so the research hypothesis would be, if there is a presence of difficult environmental circumstances, then a person is more likely to develop a substance use disorder. And then the null hypothesis would be that there is no correlation between an individual having difficult environmental circumstances and that same individual having a substance use disorder themselves. And so the type of research design that I would be using is a qualitative research design. This is the case because I'm trying to understand a very specific part of a population. So I'm trying to understand the environmental factors that people with substance use disorder have. This is also the correct type of study because it places a large importance on the context of the subject, which is one of the main goals of this study. So the type of population I would have for this study are people that have been diagnosed with a substance use disorder. They must be an adult within the age of 18 to 40 who are all in a community-run residential treatment center for their substance use disorder. And so the population, I would have one population that is in that treatment program in a low socioeconomic area, and then one in the treatment center that is in a high socioeconomic area. So it's really trying to look at the differences between the two types of areas that have a community-run residential treatment center. And I chose that type of treatment program because I wanted to focus on the accessibility of those that grew up in a low economic life, and then those with a high economic status life. So just trying to make sure that I level the playing field, because I know that a lot of residential treatment centers, people come from all across the world. So the instrument used for this would be the Adverse Childhood Experiences Questionnaire. And the ACE questionnaire is a quick 10-question quiz that anybody can take. And it's also capable of being self-scored, which is helpful when wanting to give the participants their results. And so the questionnaire will really dive deep within the individual, and it will ask them questions that really might be hard to talk about when discussing their childhood. And so that's one part of the population that we really want to focus on, is that the participants are of steady mind and that they are willing to address this part of their life. And so whenever it comes time for analysis of the results, the study will use a paired t-test to determine the difference of the ACE scores between the two groups, which will generate nominal data. This is the correct test because the purpose of a paired t-test is to identify the difference between two variables when the subject is the same. And so the subject being those diagnosed with substance use disorders, the same. And then the difference would be their environmental factors. So the goal really would to be able to look at the different ACE scores between those in a high area and a low area, and see if the people who live and are treated in a low socioeconomic area have a higher ACE score than those who live in the opposite. So that is my research study. Thank you for listening. Bye.